GM1 Gangliosidosis is a rare, inherited genetic disorder that primarily affects children. Thank you, Madam President. GM1 is a devastating disorder with many debilitating ramifications, including developmental regression, mobility deterioration, seizures, visual impairment, and neurodegeneration. It is a progressive disorder resulting in irreversible damage that the longer someone is affected, and unfortunately more than 50% of those impacted die before their 5th birthday. Faster a diagnosis can be made, the sooner a patient can work to limit the damage with therapies, medication, or clinical trials which may slow disease progression or help with symptoms. However, while research into enzyme replacement therapy, gene therapy, and other possible treatments are ongoing, there are still no approved treatments for GM1. It is that lack of standardized and scientifically proven treatment for GM1 that makes early diagnosis and awareness all the more important. This disease is still not yet well known, and it takes an average of 4 years for most families to get a diagnosis at all, which is far too long and often too late. The more we can educate people, the better chance we have to find treatments that can save lives. My first year in the Senate came across the story of Violet Law. She actually joined us here at the Senate with her family, her mom and dad and siblings, in that year. She tragically passed away in November of 2023 from GM1 at the age of 4. Her life was a beautiful one, filled with love and support, smiles, swimming, of course, Disneyland, friends, and family. Her story and the tireless efforts of her parents, Dr. David Law and Dr. Vina Sison, were incredibly moving. A family experiencing the worst, greatest parents can face and meeting that challenge with grit, poise, and purpose. Violet and her parents spurred a movement that raised thousands of dollars towards research efforts and to continue to spread awareness about GM1. Colleagues, I respectfully ask for your aye vote to raise awareness of this devastating disorder.
Thank you. Not seeing any further discussion or debate. Secretary, please call the roll.
Allen. Alvarado Gil. Aye. Archuleta. Aye. Adeguin. Aye. Ashby. Aye. Becker. Blakespear. Aye. Cabaldon. Aye. Caballero. Aye. Cervantes. Aye. Choi. Aye. Cortese. Aye. Daly. Aye. Durazo. Aye. Gonzalez. Aye. Grayson. Aye. Grove. Aye. Hurtado. Jones. Aye. Laird. Aye. Limon. Aye. McGuire. Aye. McNerney. Aye. Manjivar. Aye. Nilo. Aye. Ochoa Bog. Padilla. Aye. Perez. Aye. Reyes. Richardson. Aye. Rubio. Ciarto. Aye. Smallwood Cuevas. Aye. Stern. Aye. Strickland. Aye. Umberg. Aye. Valadares. Aye. Wahab. Aye. Weber Pearson. Aye. Wiener. Aye.
Senator Padilla moves the call. Senator Padilla, you are recognized for introduction of your guest.
Thank you very much, Madam President and colleagues. I'm pleased to welcome with us today the president and founder of Cure GM1 Foundation, Ms. Christine Wagner, who is here in honor of her daughter, Iris, and Dr. David Law, here in memory of his daughter, Violet. These people are the strong advocates that continue to work hard to raise awareness of GM1.
Welcome to the Senate. Thank you for coming.